Hello, my name is Laura Maria Caldarone, and this is The Long Haul, a Pandemic 8 Network's online series on long COVID. With us, we have Ondine Sherwood, co-founder of Long Covid SOS, a UK-based charity fighting for long COVID recognition, research, and rehabilitation since July 2020. Hi, Ondine.
Hi, thank you for inviting me, Laura.
Thank you for being here. So tell us a little bit about yourself.
My profession is in IT. I'm an IT consultant, but since June 2020, I've been working as an advocate for people with long COVID. So I got sick at the end of March 2020. It was a relatively mild initial infection. I thought it was over after about 5 days. I went out on a bike ride, felt great, came back and felt terrible. And it was basically relapsing and remitting after that. So every time I thought I'd recovered, I'd go back to normal activity. And within a day or so, I was feeling dreadful again and I didn't understand it. So I came across an article in the New York Times where they interviewed Fiona Lowenstein, who started the Body Politic COVID-19 support group. And so I applied to join. And when I first applied, I then got better and I thought, I don't need this. And then it came back and I thought, yes, I need this. So I joined the support group and I was absolutely astonished to see that there were so many people who had such terrible symptoms who hadn't recovered, young people previously fit. And I was really amazed. And I thought it was just me. I just thought, well, I'm just not able to throw this off. Typical me, I'm not getting better. And I assumed within a couple of weeks it would go. So I joined the support group, talked to a lot of people, and I remember reading about Italy where people with long COVID were threatening to take government to court. And I thought that, we've got to do something. And then my co-founder, Sandra, put out a post saying, look, should we march on Parliament? We've got to do something. Because, of course, we were being completely ignored. It struck me while I was ill with the initial infection that the people who were ill at home weren't really weren't being included in any sort of care programs. They weren't part of any research. They were just ill at home. They were speaking to 111, which was the sort of NHS helpline, talking to their GPs on the phone, maybe. But there was all the focus was on the people in hospital, which is understandably because they were very, very sick and they were dying. But what about all the rest of us? And then what about the people who weren't recovering? It wasn't being mentioned. In fact, I did have a look back to see when it was first mentioned in the press, and there was an article on BBC News, I think in May, talking about people who weren't recovering, but it was really not acknowledged. And so we talked about what we could do, and a few of us got together. There were five of us initially, and there had been a film that was made by I think it was well, it was a French group. I'm not sure if it was Après 20 jours or whether it was a precursor, but they made a film with people, or there was a Spanish film as well. There were two people. I think there was a Spanish film, people holding up pieces of paper with
Mm.
detailing their symptoms. And we decided we wanted to make a film and to write an open letter to the government explaining what's going on because they didn't appear to know or understand. And we were very lucky that there was a filmmaker in the support group with long COVID, Caroline, and she and her husband ran a company of filmmakers, Huckleberry Films, and they were really, really great. And we gathered information from the support group and from other support groups, and people sent in their photographs. And we had this theme of message in a bottle because we felt we needed to send out an SOS because people felt abandoned. They weren't being listened to. Nobody knew about them. It was a very strange situation, and so we had that theme of message in a bottle, and the resultant film was fantastic, and it really was a seminal point, I think, and that film is still being viewed, and it's still being used. It's been used in international conferences. It's been used on the radio, on the TV, and it just captured that moment so well. And at the same time, we wrote an open letter, our first letter, first of many, which we sent to Boris Johnson, our Prime Minister. We copied it to health policymakers. We copied it to all the health administrations, the NHS administrations in England and in the devolved nations. And we kind of thought, right, well, we've done that now. That's it. But of course, that was just the start. And it was a journey, but we started to get the press interested, and we did eventually get some replies to our letter, mainly from the health authorities. And of course, the big one was when we were contacted by Maria van Kerkhove from the WHO, who invited us to set up a meeting, an international meeting. So that's how it started. Yeah.
And this, now we're talking end of summer, 2020, beginning of fall, is it?
Yes, I
It's
suppose
the
so. We
first
were
year.
contacted by Maria in towards the end of July, actually. So this was all in the first month.
Mhm.
We got a reply from her in July, and the meeting took place at the end of August. We also heard from from NHS England, from Professor Powis, who was is the medical director, in August, and we set up a meeting for September. So it started happening, and we started getting some press coverage around that time. And it was I mean, it was a fast moving situation, really. And it was, at the time, it was seen, I think, by the media as being an interesting story.
Mm.
But obviously it still it was behind all the other stories. So the stories of the deaths and hospitalizations were right up there in the front, and then it was, oh, by the way, there are some people who aren't getting better, which was interesting, but not as, as newsworthy, I suppose.
Not as, newsworthy. And I mean, we're talking 2020, so the first year of the pandemic. But what you're saying right now, like you still see hospitalizations, those are the numbers, and deaths, and maybe a little bit more about long COVID, but we're talking about the UK right now. So in other countries in South America, for instance, even now, even this year, you might see an article or a comment here or there that, yes, there are long-term consequences to getting COVID, but it's not, here you hear it more.
There was this ridiculous article that came out saying, is it so many more people in the UK have long COVID than in other countries? And then they had all sorts of speculation that we're more into our health, that we're, more hypochondriac. I don't know. I mean, it was a nonsense. It's the same all over the world.
Everywhere,
The
yeah.
proportion of people who get long COVID is not going to be different in the UK to Venezuela. It's just that they're being counted in the
Yeah,
UK to some extent.
yeah.
We're very lucky that the ONS, the Office for National Statistics, got funding to run the COVID infection survey, and from that to run the long COVID prevalence surveys. They only have funding until May of next year, and of course that's a worry, because once they stop issuing their bulletins, it's going to be very hard to know where we are with long COVID and how many people have it.
Yeah.
But the problem with long COVID has always been, and this is probably why it's not in the news in other countries, is it's hard to count. You can count deaths. Sadly, of course, people argue, oh, are these deaths with COVID, of COVID, because of COVID? But you can, those you can count physically, and you know how many people are in hospital. But we don't literally count the number of people with long COVID. It's a survey based on about 300,000 people. So they look at how many people in that 300,000 who have signed up to their infection survey, how many reporting ongoing symptoms, and they extrapolate that across the population. And it's a reasonably large sample, so it's good enough. But we're not individually counted. When they tried to count us via GP codes, it came out as 23,000, because people you know, GPs weren't recording the long COVID patients with specific codes. People had stopped going to their GPs. They'd been to their GPs before the codes had been set up, and they hadn't been back because they weren't getting any help. So it's a difficult thing to count. And we've asked questions of we asked a question of one of Boris Johnson's advisors: why is it not being taken seriously? Why are we not being counted? And he found it quite hard to answer, but I got the impression they feel it's a bit nebulous, you know. What is long COVID? Is it properly defined? Are we sure that all these people have long COVID? There are people who have symptoms from lockdown, and we're not so sure about it. We can't really pin it down. So, well, we won't look at it then. So, and that's part of it. You know, it's almost as if long COVID is a matter of opinion, not fact. And that's the problem.
It's a huge problem because, I mean, it is not the first time that a virus causes long-term effects, right?
No.
It's not the first time. So already it would have been good if from the beginning we thought, hey, this is a new virus, maybe it will do the same as other viruses, and then take it from
Yes.
there, which we
Well,
didn't.
SARS, for instance,
Exactly.
I mean, it was documented that people weren't recovering
Yeah.
from SARS. Some didn't recover, or, you know, I don't know exactly the figures, but there was a high proportion who years later weren't recovered.
Yeah.
So yes, and this is part of, you know, when we look back at how this was handled, this is a big question. Why was it not anticipated? And not only anticipated, but why weren't there measures in place to deal with the possibility or probability that there would be people disabled by this virus?
Yeah.
Yeah.
And I mean, I understand because there are, you know, people that say, okay, what's past is past, like, we can't do anything, can't change the past. And in some aspects, yes, that is true, especially if you don't learn from those lessons. But fine, we couldn't anticipate, or it wasn't anticipated, but what about now? Like, now we do know that there's a certain amount of people that after one infection, they get long COVID, right? And yes, it is true that the percentage, the number itself differs depending on the study, on when the study was made. But
Mm.
the numbers go from anywhere from 2 to 5% to, I have seen, even almost 50%.
Yes, I think that there's a bit of that's one of the problems, I think, is you have such a variation in prevalence estimates, which I think probably goes some way towards people thinking, oh, it's all nonsense. They can't even work it out. I think some of these studies, and particularly the literature reviews, where they look at a whole bunch of studies in order to get a prevalence, it's skewed because in people who've been hospitalized, it's really very high. So in people who've been hospitalized, the chances of ongoing symptoms is well into the double digits, 50% maybe, particularly if you've been in ICU. Whether that's exactly the same as the sort of long COVID that people in the community have is debatable. But many studies combine people who are hospitalized and people who weren't. And so you end up with a kind of really high figure, like 35, 40, 50%. The ONS prevalence, they haven't actually published prevalence data for a while, and they looked at it in different ways, and it became quite controversial because they were looking at a control group, and of course there's issues with control groups, particularly now so many people have had COVID, but they were looking at 11 to 13%, which has likely come down because of the vaccination program. But even if it's 5% in the vaccinated, given the number of people who've had COVID and who are getting COVID every day, so that's a lot of people. And if it's 5% have long COVID, um, that's a lot of people.
Yeah, even if it's two, I mean, I did see there was a 2% in one of the studies, like 2 point, like almost 3. And
Mm,
to me, that anything above 1 is a lot,
yeah.
especially because
Yeah.
we're talking about one infection, right? But if you keep on getting reinfected, I mean, there's been
Your
studies that
chance,
are saying they're
yes,
cumulative, right? So your chance is
yes.
higher.
I think that if you don't get long COVID the first time, you can't be sure that you won't get it subsequently. We still don't know why certain people are getting long COVID. Is it genetic? Is it environmental? Is it due to pre-existing conditions which you might not even know about? Is it due to a previous infection with Epstein-Barr virus in some cases? There's lots of reasons put forward as to why certain people are getting this and not others. And I suppose you could argue, well, you know, if you're susceptible to long COVID, you get it. And if you're not, then you won't with subsequent infections. But I think what we're finding is that people are getting long COVID from reinfections. And that's very worrying because it means that the proportion of people with long COVID, even once the whole country or world has been infected, you're going to get ever more people developing long COVID. It's not going to stop. I mean, we can only hope that the virus will mutate to such an extent that it no longer inflicts such damage. But we're not seeing that because in the UK, I think it's 36% of people with long COVID got it from Omicron, and that would have been mostly vaccinated. So my hope is that a vaccine is developed which actually stops people getting COVID
Yeah.
and passing it on.
Yes, the vaccines have been great. There's no denying that. If nothing had been done, we would have had a worse 2020 and, worse
Yes.
2021 and 22.
Mm.
But yeah, it doesn't completely prevent transmission. It doesn't completely prevent getting COVID. And so obviously, I mean, the only way you get long COVID is if you get COVID. So if you get infected, then there you go, right? And
Yes. The only way to prevent long COVID is to not get infected. And to not get infected is becoming very, very difficult. How
yes,
can you, it's so hard. If you're a teacher, how can you avoid it? If you're a healthcare worker, people aren't wearing masks. I was in the hospital. It does say masks should be worn on these premises. I had my bloods done. A lovely guy took my bloods, but his mask was around his chin. And,
you you're lucky to have seen someone with a mask, even if it wasn't properly like as it should be. I
this was
haven't
in a
seen,
hospital.
yeah, and I've been to my GP a couple of times, and I think since December, at least December of last year, no mask, nothing, nobody. But the posters are still there, right? Um,
Oh yeah, the posters are there, but unless it's mandated, people just don't take it seriously. I wear a mask. If I go to any indoor place with the general public, I wear a mask. And sometimes I'll see someone else wearing one. I almost want to wave at them hi because it's so unusual. And I was at a meeting actually, and this was a public meeting to talk about COVID proposals for a COVID sort of memorial in the UK. And I spoke to a woman there who has long COVID symptoms, and she said, "Oh, I put a mask on when I walked in, but no one else was wearing one, so I took it off." And I thought, well, okay, that's your choice, but I'm not going to do that. And I do feel like a bit of a freak. I
hmm,
feel like people are looking at me thinking, what's wrong with her? There's got to be something wrong with her, or she's neurotic. But I'm going to wear the mask. I would rather wear it. It's not that difficult. It's not that uncomfortable, and lessen my chances of getting infected. But not everybody who goes into a crowded place is going to get COVID. But your chances at the moment, I would say, are reasonably high. I mean, it has a very high R number,
yeah,
whatever variant is out there at the moment. It's very easily spread.
yeah,
Um, yeah,
yeah.
it's a difficult situation. It's a difficult situation.
Do you think, I mean, now that we're talking about the masking, right? Because we know, and it's been known for a while, that masking is important because it's airborne, right? The way it's transmitted is through the air when you speak, when you breathe, exhale, shout, sing, whatever. And a mask helps, ventilation helps a lot, right? the example you gave was like, okay, nobody's wearing a mask, so that person said, I'm not going to wear a mask. And you do as you see, right?
Yeah.
But I think that's one aspect. And the other one, would you say it's also the fact that even though, yes, in the UK, there's Long COVID SOS, there's Long COVID Kids, there are articles there in newspapers, in news outlets, but it's not that spread to understand the risks of Long COVID, right? Do you think that also is another reason? Do you think maybe
Yes.
if it was more clearly informed that anybody, because it's true, anybody from children to adults of any age can get Long COVID, would it change?
I think it would, not in everybody, but I think yes, there's a proportion of the population would respond to that. But it's never been done because it is impossible for the government to really stress the truth about long COVID because it would go against the policy of opening up. I mean, our government was very proud to be one of the first countries to remove all restrictions. They saw that as a milestone, as something really important. Um, and so you can't really do that on the one hand, say it's fine to get COVID because that's what they're saying. Go out, mingle, mix, go to clubs, go, it's fine. What they're saying, they're implying that COVID is a cold. They're saying, oh, maybe stay at home if you've got symptoms, but there are plenty of people who are told they have to go to work with COVID or not. And so to have that policy in place, it means that you can't then go and say, actually, there is quite a high chance that if you do get this illness that's going around, you might not recover. And amongst those people who are not recovering, around 20% are actually disabled. They don't want to put that information out there because obviously it's a very mixed message.
Yeah, it's
So mixed messages are, one of the is considered something you just don't do, and they're trying their best to get their messaging right, and so you can't inform people of this risk and at the same time tell them they need to just forget about the pandemic, it's over. So it can't be said. So it's actually a bit of a no-no. And even the NHS can only really recommend vaccination as a preventative measure.
mm,
They cannot recommend that in order to avoid long COVID, you wear a mask or you don't go to crowded places or et cetera, et cetera. I mean, ventilation wouldn't be within their remit. But this is the problem, that the overriding narrative at the moment is that the pandemic is over and we're now getting back to normal. And to put a message out there that there's actually quite a lot of people who are really quite sick from this virus, and it could be you, they can't do that.
they can't do
And
that.
that's why they won't do that.
Even though, looking at the UK specifically, but there's been other countries around the world that have done the same thing. This narrative of the pandemic is over. If I'm not mistaken, this is the third or fourth time that the UK says that. Um, and
Yes, we
so,
opened up. Yeah,
right?
well,
So it's not
yes.
like it's not the first time, and then you might say, okay, then it's really over. But it said it's over, then oops, it's not over, continue, and then again it's over.
I think that it's going to stick now because to quote the government narrative is we've broken the link between infections and hospitalizations and death, which of course they haven't. They've not broken the link because this is vaccinations that are doing this work. The vaccinations has lessened the link between COVID hospitalizations and deaths. But just as with flu, there are hospitalizations and deaths from flu. So it's felt now that this is another circulating virus, along with all the other seasonal viruses. It just happens not to be seasonal, of course. COVID is circulating throughout the year. I don't think there's now going to be, unless something drastic happens. So, in other words, if we get a variant emerge, which is completely is completely unaffected by the current vaccines. So in other words, if a variant emerged that was um, so able to overcome the antibody response that prior infection and vaccines has initiated in people, and was causing really serious disease, so that the hospitals became overwhelmed again, then they might have to do something. But the NHS in the UK is fighting on so many fronts at the moment, and COVID is only one of them.
Yeah.
So, we have a huge backlog. We have all sorts of other seasonal viruses which are all emerging at the same time. We're not even in winter yet proper. But if a new variant was much more lethal, then maybe they'd have to turn around and say, oh, we need to bring back some restrictions. But unless that happens, it's not going to happen now. It
No.
simply won't.
Yeah, even aside from restrictions, just give more information on long COVID, because we've had the World Health Organization, not only 2020, but even recently, reiterate and say long COVID is going to be a problem. Long COVID is a
Mm,
problem. We've had the
mm.
Bank of England saying the same thing. It's a problem,
Well,
it's
yes,
going to be bigger.
it's now posing an economic problem. And I'm watching very carefully to see how that's dealt with. But it's certainly the impact on the workforce, which we predicted from our very first letter to the government, is now panning out. And it's not as if they can say, well, this is a problem. Yeah, we will have to work our way around this. This is something which is not going to get better, and is going to get worse if something isn't done to stop people getting infected. So I can't predict how that's going to be dealt with. Um, but it certainly needs to be. But I don't really see how they're going to do it, because of in kind of an entrenched position, and it's certainly not just this country who's
No.
in that situation. I mean, it's the same worldwide. So it's a bit of a problem, yes.
And I mean, as we've been talking about now, and as we've seen, long COVID has affected millions of lives around the world. And we now know, there were some indications last year in 2020, but now with more and more research being done, we now know that SARS-CoV-2 not only causes acute respiratory disease, but it can also lead to acute and post-acute sequelae beyond the lungs, right? Beyond just that part of your body,
Mm,
but basically nearly every organ system. And we know that it affects children, it can affect adults, any age, regardless of where you are in the world. And I know as part of Long COVID SOS, you have been very active in research projects, right? Tell me a little bit about that, especially like why you were active in certain projects and certain, like, focused on certain topics, and where are we right now in the research world?
um, we have tended to get involved in the research projects funded by the NIHR, which is National Institute for Health Research. So these are projects that were funded by the long COVID funding calls that were announced at the end of 2020 and early 2021. And so we are involved in the TLC project, which was funded in the first call, which is looking at ways to develop treatments for long COVID. They have come out with a validated long COVID symptom burden questionnaire, which is really useful, actually. So that's it's not a huge project, it's one of the bigger projects. We're also involved in one of the biggest studies, which was funded in the second call. And what happened with the second long COVID funding call, which was another £20 million offer, if you like, for funding from the UK government. The first call, which was also about 20 million, there were some big projects funded, but they were mainly epidemiological projects. So they were looking at who was infected, who was affected by long COVID, what sort of numbers we're talking about, what sort of symptoms, what the natural history was of the disease, which was all very well and needed to be done, but it wasn't really helping anybody who had long COVID in terms of trying to get them better. So early in 2021, we used to have a monthly roundtable meeting, which was chaired by the Undersecretary of State for Health and Social Care on long COVID, which we used to attend. And those started in about October 2020. And we knew that Matt Hancock, who at the time was the Health Secretary, Secretary of State for Health and Social Care in the UK, was going to be chairing a meeting in February. And so I got together with Dr. Heitman, who runs the long COVID clinic at UCLH. That was one of the first long COVID clinics to set up. And I was talking to her about what we could do to get research into treatments. And they were already doing some of their own research on, trying things like antihistamines and so on, but they desperately needed funding. So we decided that we would lobby Matt Hancock in this meeting to release more funds for research into treatments, because no one was getting better really, and there were no valid, well, there's still no validated treatments, but at the time nobody really knew where to start with treatments for long COVID, and there weren't any. Well, there still aren't any. But during the meeting, we both spoke quite strongly and put forward our case. I followed it up with a letter. And shortly afterwards, the next funding call, I received an email because I'm on the expert panel, on the NIHR expert panel on long COVID, and I was invited to a meeting to discuss what the research questions should be for the next funding call. And I eventually got a response from Matt Hancock, or a letter from him, to say that they had released more money. So that's how the second funding call came about. Or that's what certainly sped it up. And one of the studies that was funded is called Stimulate ICP, which is through UCL, UCLH, and other centres, where they are just recruiting now into a study looking at repurposed drugs to treat people with long COVID, and comparing them to controls, also involving MRI scanning as well, and some other interventions. But it's taken all this time for that study to get off the ground, but it's a very important study. And the chief investigator is Ami Banerjee, who's a trustee of Long Covid SOS. So we're heavily involved in that study. We do get involved in other research projects, but we're quite careful to make sure that they are properly set up, that they have the right ethical approval, that they're asking the right questions, and that they're doing everything properly. So we are partners in some other studies, smaller studies. I'm involved on the expert panel for a study looking into mechanisms run by Danny Altman, which is also recruiting now. This is a study looking at analysing immune subsets in blood to try and establish exactly what's going on, and what is different about people who have long COVID and what's going on in their immune system. Plus, we are involved in other studies, some of which are more based on talking to people, but we're trying to work mainly in the area of improving the lives of people with long COVID. There's a lot of research going on into long COVID. There's a lot of studies coming out saying we found this. I mean, a very interesting study in Canada where they found vascular biomarkers which they think can identify people with long COVID. And they're now looking at marketing this as a sort of diagnostic test, which is interesting. I do worry that because of the heterogeneity in terms of the symptoms of people with long COVID, that maybe not everybody would pass that test, but they may well still have a form of long COVID. Perhaps it's not as vascular in their case, and therefore that could actually end up excluding people and causing them to have problems in getting a diagnosis. But I think that's very interesting, and certainly the vascular nature of COVID itself, which has been clearly defined from the very, very beginning of the pandemic, is really key. And it's called a respiratory disease, but I think that's questionable. It does impact people in the acute phase, the people who have it the worst. It impacts their lungs, and yes, people do have forms of pneumonia and lung scarring. But I think we're seeing more and more that it's the perfusion of the lungs which is impacted in terms of getting oxygen from the lungs away from the lungs and into different parts of the body, and that's what's causing a lot of the problems people have in the acute phase and in long COVID. So I think that's really, really important to follow up. And because it's such a there's such a varied way in which COVID can impact anybody's body, the research has to be very wide ranging, and what we need is something to bring it all together, and that's very difficult. It's really difficult to actually find a kind of unifying principle, what is long COVID, and what's causing it. And I think that's going to be a real challenge.
To finish up, so before I ask you my last question, is there anything else that you want to say from a Long COVID SOS perspective, or just from you, that you think is important?
Well, I think it's important that it's very important that charities like ours carry on and grow, because this is not going away. Unfortunately, people are still getting long COVID, and in the future there will sadly be more pandemics, and we have to be better prepared next time, and take account of what's happened in this pandemic and understand the nature of these pathogens and how they can damage people long term. And we have to keep fighting. We're still fighting for recognition in many respects because of the prevailing mood in the country that it's over, that the pandemic is over. So it's still a struggle. We need better research, and clearly there's a long way to go before we find the right therapeutics and the right pharmaceuticals or whatever it is to get people better. So yeah, there's a long road ahead of us, I think.
My last question then is something that I always ask anyone that I speak to that has long COVID. And it will be interesting to see what you say, because not only you have long COVID, but you have also come into contact with, through your organization, through so many people that have long COVID. So I just want to know, to you, what is long COVID? How would you describe long COVID? What does it mean to have long COVID?
That's a really difficult question, because it's so different for everybody, because everyone's experience is different.
Mm.
And I think if you could ask 10 people with long COVID and you'll get different answers.
And that's
I suppose you could encapsulate it by saying the loss of a life, the loss of the life that people had before they got infected. It's the a radically changed existence for many people, not for everybody, but for many people. They cannot get back to their old lives in any shape or form. Some people manage to do some things that they used to be able to do. Some people can go back to work, but then they find it very difficult to have the energy to socialize. So I think it's having to come to terms with a changed life, a changed way of life, and a changed capacity, I suppose.
Ondine, thank you very much. It has been really a pleasure. And yeah, I wish you and Long COVID SOS all the best.
Thank you very much for having me, Laura. It's been great talking to you.
Thank you.